Hello and welcome to Let's Talk Climate. I'm Ben Florencio Turner, the Director of Climate for Health at ecoAmerica. I'm joined by Climate for Health Fellow, Dr. Bruce Bekkar, and two guests. Katherine Catalano is the Deputy Director of the Center for Climate, Health, and Equity at the American Public Health Association, and Dr. Stefan Wheat is an instructor of emergency medicine at the University of Washington and was a University of Colorado Climate and Health Science Policy Fellow with ecoAmerica. So we're going to be talking about the ClimateRx program today, and we're going to start off with Dr. Stefan Wheat, as you helped to develop the ClimateRx program.
Yeah, thanks, Ben. My inspiration for the creation of the ClimateRx campaign actually came from my experience with a similar campaign called the Vote ER campaign, which was a similar badge-oriented civic health campaign that I think set a really key and important precedent for how health topics that are not traditionally discussed in the clinical space can be championed by healthcare professionals. What I saw as climate and health science policy fellow at the University of Colorado, and what I think I continue to see today as an emergency physician at the University of Washington, is I think a hunger amongst health professionals for a tool that allows them to connect with their patients around how climate change is impacting their health. And when I was first thinking about creating something like this, I reached out to ecoAmerica and the Climate for Health program because your team are already leaders in producing content that is meant to empower clinicians for that very purpose. And so it really seemed like a really great match.
That's great. So what does it look like to use the ClimateRx badge as a clinician?
Yeah, so the great thing about using the badge is it's very easy. It's a badge that is attached to your ID badge, and a small prompt sticks out, and that prompt on the badge is "Care for your health and our climate," which prompts the viewer to ask the badge wearer about how climate and health are related. And then the badge wearer can let the patient or their colleague log in or scan the QR code and learn more and sign up if they're interested.
Yeah, Stefan, first of all, I just really want to acknowledge you for your out-of-the-box thinking and bringing this program forward with ecoAmerica. It's really exciting to me because you think about the number of times that every single day that clinicians and patients interact, and there is an element of climate that influences that patient's health. There really hasn't been an easy way to broach that subject, to bring that connection up. And as Ben was saying, to have this program built off of a QR code on a badge that you can refer to or not, I'm always thinking about what life is like for us in the trenches, taking care of patients, how much time pressure there is around that. But there are so many golden opportunities that have been missed. And I think now ClimateRx is really well situated to help clinicians make that link with patients and introduce the fact that climate is part of their health. What is going on with our climate is impacting them in negative ways. And there is information that can be shared along these lines, and also information about how they can protect other members of their family from other aspects of climate change. So this is really a breakthrough in our desire. As you were saying, there's so many clinicians. I frankly don't know what part of medicine is not impacted already by the climate crisis. And so many of us are still looking for ways to bring up these topics with patients, help educate them, help empower them. And so I've been really excited to see this program ramp up and begin to be shared. And I can just tell you, based upon conversations I've been having, meeting with clinicians, even in the past month, a handful of times, there's a lot of enthusiasm for this program. Basically, they hear about the program and the next thing out of their mouth is, where can I get a badge?
Thanks, Bruce. Yeah, I think I'm really excited about it as well. And I think, a lot of the excitement that I've heard around it is, the fact that it really does break down the barriers to entry for people being able to get involved with something like this. And, we kind of actually, from the social science research, we know what the barriers to clinicians engaging on this are. We know that clinicians are already overtaxed and they feel like they don't have the time, and that's absolutely true. And the great thing about the campaign in ClimateRx is that it's non-interruptive. You don't need to sit down and have a whole conversation with your patient about climate and health. You can just simply redirect them to the QR code, and they can learn pretty much anything that they want to know. It's also, another one of the major barriers is that most clinicians identify that they don't feel that they're knowledgeable enough about this to be able to be or speak to their patients authoritatively about this issue. And again, the great thing about ClimateRx is that you don't need to be an expert. All you have to do is care about this and care about helping your patients see how they can help protect their health from climate-related hazards. And I think finally, and I think one of the things that I'm most excited about how the potential for this this campaign is that I think a lot of clinicians worry over this kind of perceived lack of support from their peers around this issue, that it may not be seen as appropriate in the clinical space. And I think that is very much a perceived lack of support, because I think, all of us here have talked to a lot of clinicians and health professionals from a variety of different backgrounds who are very invested in this and want to be able to engage their patients. But the great thing about what ClimateRx does is that it creates a really visible community of support around this issue, because you can look around your clinic or your hospital and see other people who care about it and are wearing it on their ID badge.
Yeah, and these are all such great points. And I think that the fact that so many clinicians do care about climate, but assume that everyone else either doesn't care, is just really low on their list of priorities. This is one way, in addition to all the other values of this, as to break that ice and to help build momentum for people to even just talk about it amongst themselves as colleagues about, oh, I've noticed a lot of asthma visits to the ED after all of these wildfires. And start talking about how these climate impacts are affecting health in really obvious ways, and start planning what to do about it. So really hopeful that this can be a tool for clinicians to engage with patients, with each other, with the community, and keep building from there. And I do want to bounce over to not just the clinical side of it, but also the broader public health conversation. Katherine Catalano from APHA has been really supportive and helpful in building the ClimateRx tool and helping to launch it. So Katherine, I just want to both thank you for all of the support, as I think we brought well over 1,000 badges to the APHA conference in 2022. And we're really excited about connecting it with more public health professionals.
Yeah, thank you, Ben. We're really excited about it too. I'd say the program, at least my read, was that it was very well received at the annual meeting this year. Folks are really excited about the whole idea behind it, about, like you said, breaking that ice, talking to colleagues, to folks in the community that they work with, and obviously, field of public health has all sorts of different practitioners and academics and educators and community health workers, and there are all these different settings in which they work. But generally speaking, everyone's work, everyone's lives are touched by climate change. And unfortunately, with the intensification of the climate crisis, everyone can relate to it, and all you need is that little push to start the conversation, a little bit of initial education on, and climate change is the most existential threat to human health that our world is facing today. And it's also a big and terrifying conversation for a lot of people too. And sometimes that's why folks avoid it, is just like, well, this isn't what we're working on. And also it feels too big to tackle. So the fact that ClimateRx and the resources that you highlight really focus on solutions, on, a path to action, really also makes it very digestible in that way, not just digestible in that the resources are easy to understand for a variety of audiences, but also sort of combats some of the dread that might come with it, but with a here's what you can do about it. And I think folks really responded well to that.
That's great. And I think that you mentioned there some of the focus on educators, and both for public health and for clinical education. There's been so much growth in focusing on the climate and health connection in clinical and public health education. I know that APHA has been central in that.
Yes, we're continuing to really push for climate to be incorporated into MPH and other health education curricula. It is not universal. You know, folks usually, you know, become interested in the climate health connection and incorporate it into their education, but it is rarely a requirement. So I do think this, you know, program could definitely help bridge that gap for folks that aren't already well versed on it, that might see, you know, instructors or fellow, you know, students in any of these settings with a badge or a sticker or what have you for the ClimateRx program to, again, be able to start incorporating that into their education. Because again, there is an element of climate and health that can connect to pretty much any field. We've actually been exploring that within APHA's member sections, focus on all of these different like elements of the public health field. And we've been working with them to make those climate connections with each of their focus areas. And it has been surprisingly easy, not that surprising for us, but for others, surprisingly easy.
That's really good. So I think that between the value of ClimateRx to educators as a way to kind of engage students, and for students and early career health professionals to engage their peers as well as their community. You know, you'd be surprised how many of people a few years or several years ahead of you in their career will be open to talking about climate that you might have thought would be close to it, and that this is a good way to break that ice as well. And then as talking with Stefan and Bruce about those, the clinical support, that this is an intervention that is very, very accessible, does not need to be a confrontation, can be as long as you want it to be, and gives you the ability to talk about climate change and health without it being doom and gloom, without needing to be an expert, and with having something to do about it at the end, where they can go learn more and learn what kinds of actions they're ready to take and have the tools to do that. So I want to pause for a second just to talk about how to get a ClimateRx badge. So anyone watching this can go right to climaterx.org. It takes just a few minutes to sign up for a badge. So if you go to the provider section of climaterx.org, there's a really brief form to fill out. There's no cost. We send you a badge in the mail, and you can start wearing it every day to engage with patients, colleagues, and community about climate change and health. And if you are interested in distributing badges to your colleagues, students, or other peers or other health professionals, email us at info@climaterx.org. We're happy to send you bulk orders of 20 badges or 200 badges and help you plan out a distribution process that will work really smoothly and to help more people get connected with the badges. And my last request for anybody, if you already have a ClimateRx badge, or if you've clicked through these forms, you're going to get one in a couple of weeks, please share pictures and videos of you with your badge. We love to see people out there. It doesn't need to have patients in the picture, obviously. It can just be you with your badge talking about the experience. This is really helpful to help other providers connect with it. We use the hashtag ClimateRx. We will be happy to promote your posts and make sure that we get it connected with as many people as possible. I want to thank this group for joining today. Thanks all three of you for coming to talk about ClimateRx and for all of your support developing and implementing. Anything that you'd like to add?
I think I'd just quickly say, Ben, you know, it's been a pleasure getting to speak with all of you here today. You know, just to echo some of Catherine's comments here, you know, I think education really is kind of the foundation of this entire movement, and we absolutely need health professionals who are educated on this issue. But, you know, we also need new tools like ClimateRx that allow health professionals to translate that education and knowledge to allow them to have meaningful conversations with their patients. And after all, I mean, I think that's why health professionals do the work that we do, is that at the end of the day, it's all about, you know, the patient and helping people. And I think the great thing about ClimateRx is that it's the first patient-facing intervention of its kind for climate and health, which is really exciting.
Yeah, and I'll throw in an extra 2 cents on top of that. I agree with everything that Stefan said. And I'm thinking about the providers and the fact that we've seen so many health professionals in the last few years come into the climate advocacy space. I think because we just inherently understand what risks we're running, as Katherine so rightly pointed out. This is a very, very important time. It's a crucial time for us to be involved. But the one thing I think gets missed with advocacy efforts, particularly with health professionals, we're very conscious about everybody's time, but we also want to be aware that what a lot of doctors and nurses need is they need to find the on-ramp. They need to take their concern and their passion for nature and their true desire to help their patients and give them a way to get started. And so I actually will make a prediction that if you get your ClimateRx badge and start wearing it, you will find more people interested in it than maybe you would expect. And you'll also probably find that it feels good to be part of the solution to this crisis that we're facing, instead of being on the sidelines and just feeling anxious about it. So ClimateRx is a really beautiful way to bring more people forward in the health space and to share that information with patients and to make us all feel a bit better because we're all getting engaged in a productive way with this problem.
Yeah, and I'll just one final thought here is I want to, put a real point on the power of health voices in the climate conversation generally. There's a lot of reasons we should care about it, but obviously a lot of folks, when they first hear about it, when they're getting educated, it really needs to come from a trusted messenger, and it needs to come from someone who really can understands those connections with the person and their lives and their health and their family, and can help make those connections clearly. And with everything that goes on, related to your health, this is really just such an important part that folks need to hear about. And there's no one better for it to come from than those health professionals out there that we're trying to reach with this program.
I think that sums it up perfectly. So thank you again, Stefan, Katherine, Bruce. That concludes our time today. Thank you for inspiring our listeners to prioritize bold climate solutions that improve the health of ourselves, our families, and our communities. And everyone listening, please engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow for the latest thought leadership, resources, and episodes on climate action and advocacy. From everyone at ecoAmerica and Climate for Health, thank you for being here. Join us in caring for our climate in order to care for our health. Please be well, stay safe, and take action.